YouTube. Go live. Fantastic. Neck fixing document is here. Boom. There we go. Yay, we did it. Okay, we're live on YouTube. All right, welcome everybody. So today, this is part 2 of a only two-part series on how to kind of decompress the neck, how to fix it, how to strengthen it, how to prevent yourself from getting more messed up in the future. Does that sound good? So if you're stoked, then put a 1 in the chat. We're going to get started here. Good to see you, Shar. Good to see you, Courtney. Fantastic. Now, as well as for the people watching the replay as well, that document is right there. It's clickable. It's viewable. You should be able to go and open it up right now. I'm not going to delete it, and I will be resharing it in the main group. But as I promised, because you're my favorites here on Facebook, you're going to get it first. So go there now. And like I also said, sorry. 3 years later, that's gonna be a no. Sorry. Move on. Thank you. Okay, great. So cool. All right. So as far as the documentation goes, continuing from our conversation from yesterday, what we're going to be looking at is, really what we talked about yesterday was just to make a clear-cut definition of how neck instability, neck pain, neck problems can compress your vagus nerve in your neck, and how the compression of your vagus nerve in your neck can oftentimes lead to the pathology and the symptoms that we typically see in a lot of our, not only clients, but people who join the Facebook group, people who develop very bad issues, okay, in their health. So for those who may have missed, I'll just quickly brief overview of yesterday. What we did talk about are things like neck instability, nerve damage, muscle weakness, and compression of nerves in your neck can oftentimes exacerbate and create this bouncing back domino effect of you get instability in the neck muscles that causes lopsidedness and compression of your neck and your cervical spine, and then that leads to compression of the vagus nerve, and then more compression of those nerves that control and hold up your head and your neck. And that can be very dangerous. That's where pathologies really start to develop. And that's why, if you have a vagus nerve issue and you also have a neck issue, typically people treat those two things as separate, but they are connected, and they are going to be connected in your neck. So another thing that can get people is Lyme disease. There's all kinds of things that can happen in the neck that can really screw people up. So it's really important to understand that any kind of a viral infection, a bacterial infection, a COVID, a whiplash injury, those things can really mess up your cervical spine and cause issues. So how do we look at fixing this? Well, in the document, you're going to see there's a two-tiered approach. My go-to for most people, unless they have really, really, really bad cervical instability, is going to be to kind of go almost right to strengthening of the neck, because in strengthening of the neck does not mean placing weights on your head and doing anything weightlifty kind of stuff. It's not hardcore. Typically what I would start someone on is, maybe some neck mobility, some stretching up, down, left, right. And those kinds of things can be extraordinarily helpful to loosen things up. But then that can't be the only thing that you do. And dealing with neck issues, honestly, I don't know if it's most, but it feels like, it's more of a feels like, I don't know factually, and I don't know how I would ever know this, but it does seem like a broad majority of people have neck issues, and they manage it by going to massage, chiropractic, acupuncture, energy work, laying in bed, drugs, you name it. And it's that seems to be the vast majority of where people go for neck issue answers, or they go, and that develops over time until they have to get cervical fusion or prolotherapy or some kind of a pretty invasive procedure done. So that's not ideal. it's not ideal. It's good, but it's not ideal, and it can cause, I think it exacerbates the underlying issue further. So how do we fix it? Well, if you have really bad neck issues, there's the part 1 of the document is going to be called mobilization. Mobilization is number 1. Now, mobilization doesn't just mean like stretching your head and neck or doing these things, which are good. And you should all be doing neck movement every day. Should always be stretching, moving your body, moving the fluid, moving the lymph. You might even like massage your vagus nerve on your neck. You might do taping. You might do stimulation. There's all kinds of things you can do to make your neck feel good. When we look at to like more advanced, and I would argue more effective mobilization, that's where we're going to look at some really cool stuff. And in this document, you're going to see a link to an additional weight product. Okay. So the first thing is called a petty bone system. Now, the reason I'm putting this in the document is because traditionally this exact type of equipment was by prescription by doctor only, and you could literally not buy it online up until just a few months ago. And I was like, oh my God, that's perfect. Because, I like to give away guides and give lots of free resources to people out there who need help. And I naturally can't be like, well, just throw me money so I can buy a medical grade product for you. Just like not a position I'm going to take with the 23,000 people in this Facebook group. So anytime I can find a way so you can go buy direct, I'm like, that's fantastic, right? I'm not trying to be the middleman between your neck thoracic care. So the first system is called a petty bone. That's just the name of the person who sells it or their clinic or whatever. And what it is there's a really nice foam wrap around a string that you put on the back of your neck. You wear it like a necklace. And then it has a cinch for under your jaw. And then what you do is you take those strings and you put it on top of your door like an anchor, and then you close your door, and then you're able to kind of like sit back a little bit with your own, like this allows you to really very control. All right, Diane, thank you. Great. Okay, cool. All right. So anyway, no, you didn't. This is ridiculous. This is from, just so you guys know, that is from 2019. Somebody is coming to me from 2019 in 2023 saying, you didn't help me. I'm like, oh my God, could you have brought that up in 2019 or 2020? Anyway, I'm glad you're still around, but let's be fair here. Anyway, back on subject. So the petty bone system is a really comfortable foam insert that goes from the back of your neck to the front, and it allows you to get really good forward traction to recurve your spine while you kind of sit into it a little bit gently, of course. Always be careful. We're not like dropping into any kind of hardcore movement. And then we're releasing some of the pressure that our head puts on our discs in our neck. So it's really important that we kind of like very gently rest and provide that traction. Most people know about traction because of when they're laying on their back and the doctor pulls their head away from their body. That's typically considered like traction. There's also some units that you wear under your head and you lay down and they're automatic. You can do it at home. Honestly though, the petty bone system, out of all of the traction devices that I've seen that you can buy from home, the petty bone absolutely is the best of the best. Totally serious about that. It's really good. It may seem like there's some simple pieces to it. That's, I'm not going to argue against you. It's like, multiple components and there's a foam pad. The reason the foam is important is because it's comfortable to wear. And I think it is, I think it's worthwhile. And here's why I think it's worthwhile to go that way. Because the petty bone system normally is an anchor that you wear on a wall. But then if you look down a little bit on the next part of the document, you're going to see the incorporation of either a 2-pound or a 3-pound weight, like a small little ankle weight that you actually wrap around the string, and then you let it sit on your chest and pull down. And so what that does is it provides something that you can wear and walk around with. And it does a thoracic counterweight right here under the back of your neck and kind of settles down here, and it will pull your head and neck forward, but only the bottom part, while your head is left to stand up straight. Because like I think it was it Courtney or someone else, maybe it was Sue or something like that, I don't remember exactly, but they said, what if my neck is straight, like if I have military neck? Lots of people do have that. That's a big problem. So if your neck is really straight, we need to provide some curvature on the very bottom to recurve it. Now, just so you know, in terms of there are lots of options out there for recurving your neck. I think honestly the solutions in this document are going to be actually probably the most affordable and most practical for most people. Just so you know, there are big ass like FDA cervical collars that pump air into your back and do all kinds of wacky stuff. And those can be like $200 to $300. All total, the cart for the mobilization section in this document is less than $100. So for less than $100, you can get some really good stuff. And also for those who may or may not know Dr. Hauser, who's over at Caring Medical in Florida, who does really great work if you need your neck really, like if you have an emergency and you need prolotherapy and you want to spend $7,000, you go right down to Caring Medical. And after they do the prolotherapy in your neck, they're going to give you the exact same thing that we're including in the document. So you could, if you're not at the point where you need prolotherapy right now, try this out first, because you can tell that if Dr. Hauser's main long-term treatment is to provide a thoracic counterweight, which is called the Halo, but like I said, that's a doctor's prescription only device, then you really need to probably build the Pettibone thoracic counterweight system there. So those are going to be the first two things in the document that are really, 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 really important to get. I have the exact same system. For me, as someone who strengthens my neck a lot, personally, as a guy, I would recommend generally going for like 10 pounds of weight versus if you're female and you have a smaller stature, smaller body, you want to be at like maybe, honestly, I found 5 pounds works great for females. 7 to 10 pounds works great for male necks. I just have noticed that difference. So the thing I've linked to in the document is a 5-pound weight. If you're a guy, you can either look for a 10-pound weight of that or 2 5-pounders. Either works. Honestly, 2 5-pounders will give you like good variability for weights that you can wear in different parts of your body for exercise. So not a bad investment to make. And they're only like $16 for those things. So probably a good idea. So that's first part of mobilization. Second part of mobilization is a specific rounded bit of plastic that you lay down on and you lay your head on it. You're going to lay your head down on this thing and just lay down there for probably like 5 to 10 minutes. And it's going to help introduce the right curvature back into your spine again. It's really fantastic. Highly recommend this. A lot of my clients, I shared this device with them because they're in my Inner Circle coaching program. So they get first dibs when anything goes on sale. They were able to get that device for only $9. I believe Shar, did you get that one that I'm talking about? It's that rounded plastic device that curves. It's kind of a rubberized device with a nice, I think, some kind of a covering on it. You did get that? Good. So, and you like it? Is it a thumbs up? 100%? Should people get it? Amazing. Awesome. Yeah. So she says amazing. And that's the kind of thing that I do as well, right? I even though I'm a younger guy, I still have had my fair share of neck related incidents. I was rear-ended on the freeway in 2016, and that caused some pretty bad neck issues that I've had to deal with for a long time. And, the main thing that the medical system will throw at you are drugs, gabapentin they gave me steroids, they gave me physical therapy, they gave me lots of things. They even did a steroid injection right into my spine because my discs were leaking into my spinal column and causing like irritation, really bad. But it wasn't until I started learning about like at-home traction, neck strengthening, these kinds of things that I was like, wow, these make me feel a lot better than the drugs that I have to keep, spending thousands of dollars on. So I would highly encourage you to, maybe do both, right? Look at it from not an and or, but an and kind of position. You could do both, but you should be doing both, if anything. So yeah, anyway, so that neck curvature, that's in the document. You can go click on that today and open it up, and the links to it on Amazon will be there. Now, it's not on discount like it was a couple weeks ago, but if you're in our inner circle and you're kind of in an active coaching program, then you'll probably save a ton of money being in that. We also do full script too, so we provide 35% off of full script orders as well. So if you have big orders on supplements or whatever too, then you get those too. But anyway, I would honestly though, because of how beneficial that is, I wouldn't wait. It's only like $19. Like, who cares? Like, whatever, $19. Oh my God. It's a great tool. Definitely worth it. And then the last mobilization tool is a neck pump. So it's going to be a cervical collar that you wear. Now, look, we've all seen these devices, I'm sure. They look kind of gimmicky or hokey. They're kind of like 3 different pillows stacked. There's a heart, like a blood pressure monitor cuff pump, and you pump it up. You kind of Velcro it to your neck, and then you pump it up. And it's going to provide full rounded head traction for your whole head and neck. It looks like a gimmick. I have a physical therapist who is working as one of our employees in our program. I always have him check this stuff. He read into the literature and he's like, damn, there's been a lot of literature written about this particular neck pump, and this stuff works. Clinically, it's been validated. And I was like, really? I thought it was just like some totally stupid gimmick. So immediately I was like, okay, cool. Well, if that's a good, then let's get it out there for sure. And it also, that one particularly includes a little ball that you can put on the back of your neck and go up against a wall with and give yourself a nice little pressure point massage. So it's that orange ball that's included in that specific document, which you'll see as well in the document. So I would just encourage you to go get that, download that, or bookmark it or something like that. And so, again, buying recommendations for these kinds of things is buy what you can right now. You don't have to break the bank buying this kind of stuff. I wouldn't recommend you buy everything in there, but just add and, kind of keep it on your radar of, oh, cool, like maybe I'll start here slow with this first thing. Do I get some good results? Does Sterling know what he's talking about? Of course I do. But you can, again, the proof is in the pudding. I can just say stuff and then you can try it and then you go, oh. And also I think you can return all this stuff too. So if you like absolutely hate it, then send it back, right? Super simple. So that's mobilization. Everybody clear on mobilization? Do you guys feel like you have a good sense of what we're doing? If you do, I want you to write the word mobilization in the chat. Mobilization. Or if you can't do that, type a 2. Type a 2 in the chat. So I know you're with me, right? Did I lose you? Are you like, this is so complicated? I have to do all this stuff, right? Yeah, sometimes it can be a little bit more complicated. Not everything is just a pill, right? But these kinds of things feel amazing. Great. Courtney, Shar, thank you so much. So mobilization is going to be step 1 when it comes to working on the neck. Oh, Ben, you're back. Great. I'm so glad you're here. I was hoping that you would be able to join us today. So Ben, for you especially, I mean, I don't know all of your particulars, but the mobilization in that document is going to give you some really good places to start. Okay. So we're good on mobilization. That's the first thing I would recommend in part 2, electric boogaloo for this video. Now, part 2 of part 2 is the second half of that document. And that is called neck strengthening, okay? So neck strengthening is a very important part of the process. Just to belay any fears, okay, like I mentioned at the beginning, when we talk about strengthening the neck, I'm not talking about like bearing down a ton of weight or doing anything irresponsible or anything like that, okay? This kind of stuff you need to have respect for the neck. But there are some things you can do that can help strengthen the muscles in your neck. I've posted in the chat right here on Facebook a protocol that we've had out for years and years that is extraordinarily beneficial for repairing and strengthening the muscular coordination in your neck muscles. When neck coordination breaks down in your neck, that means that every time you turn your head and neck, A bone can get stuck in one position and it doesn't rotate back with your head. Guess what there are two things that get affected the most when you have that kind of muscular instability. First thing is going to be your blood. Your blood flow to your brain is the first thing that gets cut off when you have bad neck muscle coordination. The second, and that's bad. That's bad because you lose blood flow, you lose oxygen. Your lymph gets backed up in your head. You get brain fog. You get loss of consciousness. That's really bad, okay? So weak muscles are terrible for your neck, for your blood flow. But the second thing, and I would argue maybe the most important part of it, I mean, blood, oxygen to your brain, that is, I can't argue that is probably pretty darn important given all the factors. But the other thing that's going to be affected also at the same time with you moving your head and neck and you having weaker muscles on the right side versus the left side, and it's coordinating the rotation process or up and down improperly, which will lead to instability and pressure on your vagus nerve. And when you have pressure on your vagus nerve from unstable muscles that haven't been exercised, because what's the best way to correct for muscle imbalances in the body? Is it a surgery? So you're like, doctor, my left arm is a little bit weaker than my right arm. What's the best way to fix that? Is it going to be I'm just going to get my scalpel out and just kind of sever some of the nerves on your right side, and then you'll have perfect balance between the two? No, that's not going to work. What about injections? Maybe you could inject a bunch of steroids just in the left arm and fix that. That could actually work. But what were the underlying causes of the muscle weakness? If you're not addressing those, then just pumping steroids into your muscles on one side just to fix instability. Anytime you have really strong shoulders on the right side and really weak ones on the left side, you develop severe instability of your head and neck. Steroids are not a good idea. I'm sure you know where I'm getting to. Pills are not a good idea. Pills wouldn't work. Would massage therapy work exactly? No, not really. Temporarily, yes, but long-term, not at all. We'll just skip to what I think would be the best thing, would be to actually to put resistance against some of these muscles with an inflatable red ball that you buy on Amazon for $19. You pump it up to 80%. The link is in the chat here. And you put it against the wall and you just go 10 times on the left side and then 10 times on the right side. You do it equal times and you're like, but shouldn't I do it like 15 times on the left and 5 times on the right? No, because you don't want your right then to get weaker. And if your right side is really stronger and you do 10, then it's going to be easy to push to the right. If your left side is weak and you do 10, it'll be more difficult, thus making your muscles grow faster on the left side. You want to have them kind of catch up at a higher level. You don't want to do this where you bring down your right side. You don't want to weaken your right side and strengthen your right side. That seems like a good idea, but ideally, you want to actually bring them both up to meet here, and that's why you want to follow the protocol in that document, in the red ball neck strengthening document. The link for that is also going to be here in the document. So we're going to call that red ball neck strengthening PDF download link. That's going to be found in the document. Okay. Let me see. How do we get this here? Heading 3. Is that right? Yeah. So for neck strengthening specifically, there are really only two. Honestly, if I'm being really honest with you, there are really only two good options for strengthening the neck properly. One is $19, which is the red ball. For the vast majority, I'd say for 51% of you watching, red ball is going to be fine. For those who are a little bit more adventurous, who are interested in, seeing like, what would it be like to move my neck and head and not have any crunching or cracking ever again? That is the kind of strengthening that you can get out of the iron neck system. So the iron neck system is actually right here behind me. I have one right there on my wall. That's my second one, just so you know. This is version 3, and I have version 2 in my home gym, and I use these back and forth, right? I take this one to the gym with me. I use that one at home. They're fantastic. They provide resistance training with rotation, and you can do all this kind of stuff with it. Go to their website, ironneck.com. The link is in the guidebook as well. So highly recommend that you do consider at some point in your care plan to go for something like the Iron Neck, which can also be used at home with the same kind of anchors on your door that the Pettibone system uses. So you can kind of deck a part of your house out for, all right, this is going to be my exercise and mobilization station in my house. So you don't have to go to a gym. You don't have to go to a chiropractor if you don't absolutely need it. Sometimes, yeah, like for instance, my partner was playing tennis a couple weeks ago for the first time in years, and they kind of threw their rib cage out of whack a little bit. You know, they're hitting the ball a little bit too much, and they developed kind of a spasm in their back. Chiropractor, right? And some muscle relaxants actually helped a lot. So if you do overexert yourself from a sport or something like that, and I wouldn't recommend tennis. Honestly, tennis is a bad sport. Play racquetball or something like that instead. All that running back and forth and the big swings and is really, you know, again, as you get older, you just have to accept that you're not going to be able to do the same kind of sports as you did when you were 20, right? So I think, you know, a higher level thing of how do we make this all work is try to do things that won't really re-injure yourself again and again and again. But, you know, for the neck is we can never, you know, no amount of knowledge, no amount of preparation can ever prevent you from getting a neck impingement issue or a neck injury or anything like that. I can't use magic here and say, well, you're never going to trip and fall. You're never going to wake up in the wrong position. You're never going to sleep like this on a couch on, you know, a trip to Europe and wake up with a bad neck. But what I can tell you is that if you get better at mobilizing your neck and fixing it after, then even those inevitable things won't be so debilitating. So it's really important to make sure that you get really good at knowing what to do in the instance of an injury to your neck. And it's not going to be call your chiropractor, go get an injection, go get on gabapentin or take steroids or anything like that, or put a neck brace on. Honestly, one of the worst things you could do for fixing a neck issue is to go get a brace and just be like, all right, well, I'm just not going to use my neck for the next 2 weeks. That has been shown time and time again to only make things far worse. You put yourself at much greater risk of injury if you put your neck in a cast. And this is the same thing with any kind of injury to your body. Any kind of a soft tissue injury that happens to your muscles or your ligaments or your joints, where you respond by saying, well, I guess what the doctor recommends is just some bed rest. I'm just going to lay in bed for the next week and it'll heal up. No, that has literally been studied for decades since it was invented in the 60s. That's what they used to tell people. Lay in bed, put a brace on it, immobilize it, put ice on it, and don't walk on it, was the advice that was given. That is such bad advice. And if that's the kind of way that you're doing it, you probably, I would estimate that you're getting re-injured again and again in the same area. And that's exactly a result of not using the thing that got injured immediately afterwards. Let me tell you a quick story. So I own a lot of cool exercise products, okay? I recently moved some of my gym equipment from a second home to my other home, and one of them is called a speed belt. And what a speed belt is maybe I can share it in the link. I'm not suggesting that you buy this, okay? But it is something that I do have, and it is pretty cool. It's good. It's something that you use for learning how to run faster, okay? So when you want to learn how to run faster, you use something called a speed belt. I'm going to put that in the chat. Now, I'm not recommending you buy this, okay? But I'm just saying that I did buy this before, and I used it in my new place. It's a belt that you wear around your waist, and it's got a long stretchy band, and then you have to hook one end to your belt and then another end to a anchor point somewhere away. And then what you do is you run away from it really fast, and it stretches out like 50 feet long, and it gets harder and harder to run away the further you get until it increases in resistance. And that's supposed to train your legs to be able to fire better, faster, so you can run better and sprint faster. That's the idea. I love running. I love sprinting, especially. So I bought that, no biggie. It's like $47. It's very easy to get, but I'm not recommending you get one. Anyway, so what happened, funny story, was in my excitement to use it again, because it's like, oh, it's a long lost piece of exercise equipment. I haven't seen this for months. Like, I want to try it out today. Like, it's like, my exercise equipment is like my goodie bag for me. I'm like excited to get home because I'm like, oh, I'm going to do some iron neck. I'm going to do some resistance. I'm going to lift some weights. I'm going to do some push-ups, some pull-ups. Exercise is important. You wonder, like, how do you have, Sterling, how do you have all the energy to do these lives every day and do all the work you do? I'm like, oh, because I exercise. Honestly, my exercise gives me energy personally, and coffee, but that's another thing. So anyway, I hooked the other end of the speed belt onto the fence between me and my neighbor's yard. I have a big backyard, but we have a kind of a chain link fence between us. What do they say? Your best neighbor is a fence, right? A good fence makes a good neighbor. My neighbors are nice, but whatever. Anyway, so I hooked onto a part of the fence that I thought, okay, that's a secure spot. Turns out that it was a piece of wire that was actually kind of like hand wrapped or whatever, that looked strong. And so I ran away from it. I thought, okay, cool, it's hooked on both ends. I'm going to run away from the fence on the lawn, jumping, heaving, hoeing. The resistance is getting bigger. It's working as intended. It's providing resistance when I run. And I got all the way to the end, and then I kind of walked back. I was like, cool, great. This all works. So I thought, okay, second time I'm going to run really hard to the very end and see how much resistance I can have on it. I get to the very far end of the yard. The band is at full max resistance, and for whatever reason, the hook undoes itself and shortens like a rubber band. And the place that it decides to hit me is on my right calf muscle, right behind my knee. And the pain was so bad. I don't normally yell or anything like that. I was just like, oh my God. And I looked down, and it was just like red, like bright red. Anybody have this? Yeah, like exactly, Courtney. It was very painful. And then you started to see the swelling happen. And I immediately took the belt off, and I was like, okay, I'm done, right? And I looked and saw what happened, and it was so much force. It's probably 150 pounds of actual force yanking on that fence. It literally pulled one of the steel wraps undone on that fence. So, I should have used better equipment. I should have been smarter about this. But I wasn't. And, what happened. So I immediately went into, this is where I started to follow a specific protocol. Because, ouchie, yeah, it hurt. It did hurt. It still is sore today. It's very swollen today. My partner was like, yeah, it's going to get like deep red, purple, and blue. Probably take about a week. And I was like, okay. She works in medicine, so she knows her stuff. And she was right. But I immediately went, okay, what is the protocol? First thing you have to do when there's a soft tissue injury is not to go and say, oh, well, I guess I'm just going to lay down and just ice it. That is a bad idea. First thing I did, and I'm telling you, this is a very well-studied protocol. It starts with mobilization and then exercise. So here's what I did. I mobilized it. I started doing stretching. I started putting my foot, and I started stretching my leg out like this. Trying to do, pulling my leg, try to extend that muscle. Trying to get my leg extended as much as possible to try and get some fluid and some motion in there. Because what's happening right now is the muscles are going, like they're all responding. My inflammation is going up in that area because, your body doesn't know if you lacerated and cut yourself, if you're bleeding initially. It just has to assume that if there's pain in your body's going to go right to it and start to try to fix it. That's how you allegedly recover from things. I think it's true. So I immediately started doing mobilizations. I started stretching my leg, pulling it back, lengthening it, doing anything I could to try and move the area. A corollary for the neck would be, oh, your neck hurts. Like, well, have you tried kind of stretching out some of the muscles, doing this, looking down, looking up? Some of the things that we're telling you to do in this guide. Mobilization should come first in a tissue injury. Now, it's better to do it I was lucky because I know this stuff. It's second nature. I have clients, I tell them all the time, oh, something happened, do this, and this, right? So for me, it's ingrained. But for someone else, they might not have fixed it that early on, and now they might be like kind of playing catch up. So they might have maybe it was an injury 2 months ago that's still kind of sore. Best time to do it, what is yesterday or immediately? The next best time is right now, today. So mobilization. How do you mobilize and stretch this area? Now, you don't do it so you're like, ow, ow, ow. If it hurts like that, then you don't go any further than that. Obviously, use some common sense. But if it's an owie, you want to kind of move your head and neck and see okay, wow, I have limited range of motion. My neck's really tight, or there's crunching. You need to find that out. You need to kind of test and probe what you can do to what range you can do it. Then once you've done that, that's therapeutically mobilizing your body. So that's what I did with my leg, with my knee or calf muscle, basically. Then I went, okay, how do I exercise it? So I immediately started doing calf raises. I grabbed a 25-pound weight in one hand. I put a little foam yoga block on the ground, put my foot on it, and I started doing these, like this, against resistance, exercise. This is not what would have been recommended 30 years ago, but this is what's been studied in sports medicine. We have people playing sports all day, 24/7 in this country, America, really good at sports. A lot of people get injured. This is well-known, established science at this point in time. You absolutely must mobilize and then exercise the specific injury. Put weight on it. Start walking. Use it. If it's a broken bone, you'll know because you won't be able to walk at all. And then you need to call an ambulance or get to the emergency room. If you have a broken bone, I fortunately knew that it was not broken. It was just so much force that it was like a compression injury, basically. So I mobilized. I exercised, okay? This is standard protocol for if it's your neck, if it's your leg, if it's your arm, if it's your back, any of these things, it's the same protocol. Your body works and responds the same way. So then I did exercise. I put some weight on it, did some calf raises, kind of did some squats. I stood up and I grabbed a weight and I just started doing some squats, kind of bending the leg and seeing what kind of pressure I could put on it. Nothing was excruciatingly painful. Nothing hurt, so I was good. Then after that, I did the next step, and that's applying an analgesic. The next thing you do, if you have a really bad injury, you need to apply something that's like a topical analgesic. So I have lots of stuff at my disposal. I have arnica. I have Tiger Balm. I actually have Aleve, which is a topical cream. I have CBD. I have all kinds of stuff in my cornucopia that I can reach for. So I started with one, gave it 10 minutes to seep in. I didn't just go applying everything all at once. And then I took one Tylenol. I just took one Tylenol. Because again, the thing that's going to really cause a lot of inflammation and maybe even further restrict blood flow, especially in that area, is too much inflammation in the area. And that will cause more, pressure issues. Sandy, you're so welcome. Thank you. Just what I'm looking for. Good. It's just what the doctor ordered. I'm not a doctor, but it is what the doctor ordered. Okay. The doctor. So the third step is applying an analgesic to the injury spot. And that could be either something you take orally or something you apply to the actual injury. If it's your neck and you hurt yourself, you got a boo-boo, you woke up that morning and it hurts, the first thing you do not reach for if you have a neck injury is the pills. The first thing you do is you go, oh, wow, my neck kind of hurts this morning. What can I do? What's my mobilization practice? Then where's the red ball? Now I'm going to do how much pressure can it take? Because you might find that just applying some pressure can actually relieve the pain. It could just be that the muscle needs a little bit of activation to release. You don't need to go running for opioid pills or Tylenol or anything like that. Sometimes these fixes can be very straightforward. So you need to mobilize, exercise, and then analgesic. Okay? Analgesics are anything that numbs pain. Pain reduction is important post-injury, and I won't hear anything otherwise. If you have this weird belief in your head that, that you can't take anything that relieves pain, pain is an important signal. The signal was sent, okay? You could see my leg was swollen and red. The message got across, folks, okay? I didn't need to be in pain for the next 3 hours. When I have Tylenol, I have Aleve, I have CBD, I have Tiger Balm, I have Arnica. I have all kinds of good stuff that can help reduce pain. So I did it. That's what you should do. That's what you're supposed to do. That's the smart thing to do. Then the last step is T, therapy. Therapy. That's where you apply a hot compress. Apply heat to the area. Guess what the first thing I did? Grabbed my ultrasound, applied it right to the area with gel, and I started actually ultrasounding the area. Ultrasound is a fantastic thing for repairing tissue. It promotes tissue regeneration almost immediately upon application. Ultrasound is a fantastic modality. That's why every physical therapist worth their salt has an ultrasound in their office. It's been used since the 1970s, for Christ's sake. It's very good. It maybe goes back to the 1960s, 50s even, as a therapeutic intervention. Ultrasound is fantastic. That was one that would be considered a therapy. But right after the injury, I needed to mobilize it. I needed to exercise it. I needed the application of analgesics, and then therapy. Therapy can also be, I ran a hot bath. I put my both legs in there. It was really for the heat to get to that area. Heat is better than cold. Heat is a priority versus icing. Icing is a thing of last resort. I applied ultrasound, I applied heat, then I got a massage gun with a ice cold tip, which I keep in the refrigerator. It's a special device called the Tim Tam. It's not behind me, it's in my other room. But it has a nice cold tip that you put in the refrigerator, in the freezer, and when you take it out, you screw it onto the tip of the massage gun, and I had it on a very low rhythmic kind of pulsing, and it really felt good. You would think that applying it to something like that would be bad, but that therapy is manual manipulation. Physical therapeutic manipulation and movement is considered therapeutic, okay? So I applied massage gun with a cold tip only after I did ultrasound and after heat. And then that was really about it. That's all I did. And I was able to get up and walk around in about 1 hour. I just kind of did the thing. And the next day I was walking. And today I went walking around Seattle. I had a couple of big meetings. I was no problem. If I take my finger and I really jam it into this part of my body, it's still sore, but it's not nearly as bad. And I did again, the next day, day 2, I pretty much did the same thing. I stretched it. I exercised it. I applied another round of analgesics, CBD this time, just CBD. And I think I took one more Tylenol, right? It's easy. Tylenol's great. It does work. And then I did the therapy. That's when I applied ultrasound and took a hot bath again. And with those 2 days in a row, just following that standard mobilization, exercise, analgesic, therapy, I was able to make what could have been a really severe injury. Again, if you don't know, that's 150 pounds of a stretchy 50-pound bungee cord snapping off of the fence and slamming into my leg right behind my right kneecap. That's an area where people get meniscus damage, ACL tears. I'm really lucky that it wasn't any worse than that. But I have a big enough calf muscle in the area that it was able to take the brunt of that force. But geez, that was painful. And so, again, there's a process that you follow for recovery. And when it comes to your neck, it's really the same thing. There's no difference from the perspective of good therapy between, an injury like that or this. So, cool. All right. So we've talked through this a lot. Last thing I would ask for you is just so that I know you're with me, write strengthening, okay? Would it be, or write exercise in the chat so I know that you know what the second step is, because that's what this document contains. Because, you know, the document's not going to contain links to analgesics or a hot bath or a hot compress or anything like that. It doesn't cover those other things. Everybody's so particular about like, oh, I don't want to take any pain medications. I only do CBD. I only do this. I'm like, okay, whatever, dude. Like, you just know the theory behind it, okay, at least. But this is going to cover specifically, there are tools. Good. Thank you. Exercise from Courtney, Ben, exercise. Good. I hope you guys do take action on this stuff because this document is fantastic. I'm going to share it again because I know how Facebook, the chat thing kind of like hides old posts. So I'm going to repost it again just so people know what we're looking at. This is Anshar. Thank you. Good. So this is the neck fixing guide. This is a fantastic document. You know, God, you know, there's got to be something. There's absolutely got to be something to, you know, having spent this much time really exploring what the options are and making sure people have the right links to this kind of stuff. So there you go. Really good. Really, really good. Cool. So as far as that goes, that document can be bookmarked. That should stay open, should be publicly available for forever. I don't have any plans of deleting it. But like I said yesterday, sometimes when I share a link in the big Facebook group with the 23,000 people, which I will be doing tomorrow, just be aware, I told you I would share it in the live video first, and then it's going to go live there. And we typically have like 200 to 300 people asking for it. These things are obnoxiously popular. So the first tool on there, the Pettibone, is not mass manufactured like the other stuff. So the Pettibone neck thoracic thingy-mabobber might actually go out of stock or something like that. Honestly, out of all of those, I think that is probably the best one. Most likely. That's my opinion. So I would definitely recommend that you do that. Definitely recommend that you go there and pick up the first two things in that document. Those two things are not mass manufactured pieces of equipment, and they could likely go out of stock. So there you go. I don't sell them or anything like that, so whatever. Okay, cool. So that, honestly, I don't think there's much more to say about this. One thing I will say is I tried to put the word electric boogaloo in the title of the Facebook video, and Facebook was like, that is not allowed. I think I know why, but anyway, I tried to put the word electric boogaloo, you know, because we're doing neck compression causing vagus nerve issues, part 2, electric boogaloo, because that movie from the 1980s, that's a fantastic movie. If you haven't seen it, it's called Breakin' 2 Electric Boogaloo. The best sequel name for any movie that I've ever seen, ever. Legitimately. I'm a fan of the 80s, you know. What was it? The first one was come out in the 80s. I think the second one came out in the 80s too. I don't know exactly. Maybe it was the early 90s, but it's fucking awesome. So go and watch that movie too. Get your neck in order and then go order Breakin' 2 Electric Boogaloo. But Facebook will not let me use that. It's apparently a banned word. I know why, but I think it's just stupid. It's kind of unfair, but whatever. Anyway, all right, so that's gonna do it for the YouTube folks. Thanks so much for watching on YouTube. If you like these videos, feel free to like and subscribe so we can keep these coming. And as well, a like and a subscribe on the YouTube channel keeps all this stuff free. So I'm not going to be doing ad reads for weird pills or dick pills or VPNs. So even for those who are on Facebook, if you do want to head over to the YouTube channel, just drop a like and a subscribe as a nice way to kind of help push this out to the larger YouTube audience. That'd be great. Don't need to, whatever. It's up to you. But if you like it, then help a brother out. All right, so thanks, YouTube. See you later. Cool. So Facebook, folks.